word from the Chancellor, Jeremy Hunt, that it was an independent process on all these public pay issues. However, we've got the unions, with the GMB, of course, due to meet Steve Barclay this afternoon, saying, in their view, there is nothing independent about these pay review bodies.
Well, they would suggest that because the two examples they use, Mark, in this process is, first of all, in the past, the government, the Conservative Party, have ignored the independent pay review body's suggestions. I think in 2018, when they suggested that nurses should get a higher pay rise, the government only offered them 1%. So they say the government's not taking a consistent line. But probably more fundamentally and imminently is that actually much of this pay review carried out by the independent body was before inflation was predicted to hit double figures. In fact, they worked on figures where inflation was due to hit around 4%. Now, clearly it's been substantially higher than that, around 10, 11% over the last couple of months. And that's why they suggest that actually this process is unfair, that the government, yes, are relying on the independent pay bodies, but they are working on a false basis of inflation that would be substantially much lower in the past. Now, the government at the moment, of course, are digging in their heels on all of this. They are saying that, yes, they will meet with the unions. They're not prepared to discuss pay. The unions, though, suggesting that even when it comes to emergency cover, that Steve Barclay, the health minister, who we've heard from in the last hour or so, didn't really set aside an awful lot of time to discuss potential contingency plans that could be in place. Now, the unions are saying at the moment, Mark, that what they're doing is working on a local area basis in terms of what cover might be provided in different NHS trusts, rather than a national strategy, with the government slightly frustrated with. And all this, as you say, while the government prepared to call in a certain number of troops to try and help out, but they're limited in what they can do around rules and regulations, not with the nurses specifically, but with the paramedics that we're likely to see on strike tomorrow. We are going to hear from Rishi Sunak, the Prime Minister, a little later on in Parliament. He's going to be in front of MPs. But at the moment, he does not seem like he's budging on this. It was not talked about at Cabinet this morning, though there was a Cobra meeting yesterday, and there is expected to be another one tomorrow. But that's been chaired by Oliver Dowden rather than by the Prime Minister himself. And some are suggesting, even within his own party, that the Prime Minister needs to get a grip of this and take some form of personal responsibility. Yeah,
as we're speaking, Darren, the situation inside the chamber, or in the Houses of Parliament there, they've got a health committee meeting with various people talking and updating MPs. Now, we understand there's a union chief who's just urged the government to make us an offer on pay to avert the strike by ambulance workers tomorrow, and that leader warning the service already struggling under huge pressure, apparently telling MPs we cannot hit response times. Paramedics are stuck for hours outside hospitals waiting to hand over patients. Now, this is a theme not just with the ambulance workers, but with the nurses. It's not just about pay. It's about the working conditions and the problems they're encountering day to day trying to deliver the health service.
Yeah, indeed, when you listen to what nurses have to say up and down the country, and it's not just, of course, in England, but also in Wales and Northern Ireland too, they say that they're stretched irrespective of pay, that there simply are not enough nurses to be able to provide the level of care that they want to do. That is also an issue they want the government to address. Now, in many ways, of course, that is a longer-term issue about training or indeed nurses potentially coming from elsewhere in the world to work inside the NHS. But fundamentally, the nurses and indeed paramedics are not prepared to move on any of this until the government are at least willing to look at pay, which up until now they've not been. But yeah, you listen to people who work in the health sector, Mark, and they'd already suggested that this winter was going to be incredibly tough, with the hangover from COVID, with the expectation that a lot of people are going to catch flu who've not had it over the last couple of years. Coronavirus itself has not necessarily gone away, and we already had pretty bad waiting times before the pandemic, and you add on to that the fact that there are going to be fewer health service workers working for the next couple of days. It is going to put up incredible strain on the service, and that is why government ministers this morning, when asked about whether they can guarantee that people who've had strokes or heart attacks or fallen down some stairs are going to get the response they need or should get, they couldn't provide that guarantee at all.
Yeah, real worries as of course, the army are being trained just down at Wellington Barracks from you there to actually man those ambulances tomorrow. Darren, for the moment, thank you very much indeed. Let's just